I'd now like to demonstrate for you an alternative treatment technique for what we'll assume to be treatment of a left-sided posterior canal, Canalithiasis BPPV. So again, what we need to do is orient the posterior canal in the plane of gravity, so 45-degree left rotation will be maintained, and this is what we term a deep Hallpike to long-sitting treatment. So we've got free-floating debris in the posterior canal. We're going to ask our patient to go ahead and lay flat on their back while maintaining this 45-degree head motion. So I like to position my hand right here behind the patient's neck in order to help stabilize it and to maintain that cervical spine rotation. And then I'll use my left hand here to kind of help guide their torso back. So on the count of 3, let's go ahead and lay back. 1, 2, and 3. All right. And so this is a deep Hallpike, so we're going to go into a little bit greater than 20 degrees of extension, and I like to go into about 50 to 60 degrees depending upon the flexibility of the patient's neck. Now that we're holding this position, again, we're going to be assessing for any nystagmus or complaints of vertigo. Assuming we've already identified those with the Hallpike test, which this is initially, we would want to confirm that it's the same nystagmus and the same complaints that we were witnessing before. And now what we're going to do is we're going to come to the other side of the patient. And now we're going to assume the different position with the different hand held, and we're going to ask the patient to go ahead and grab onto my forearms. Now, next what we're going to do is we're going to be going into a long sitting position very briskly. So on the count of 3, we're going to sit up quite quickly, okay? 1, 2, and 3. Come on up. And now we're going to ask the patient to go into some cervical flexion right here. And in this position, the debris should be evacuating the canal. So anticipate symptoms and some dizziness or postural imbalance during this position, and always maintain a good hold on your patient. After that, we can tip their head up, and that's how you do a deep Hallpike to sitting.